Hi, Dr. Payne with Rejuvenate Health and Wellness Centers here in Fort Worth, Texas. I wanted to do a video where I address going back to the basics. And that's what this whole year is all about, is teaching you things about chiropractic and going back to the foundational concepts to help you understand what it is, the benefits from it, and also what's available to you if you suffer from pain, right? If you suffer from joint pain, you feel like your posture is off, you have muscle imbalances. So I wanted to do a quick little video to explain what is chiropractic. I got asked this yesterday, and it really opened my eyes to the fact that people still have misunderstandings or they believe myths that are out there about chiropractic. So that's what I'll be doing this week, is addressing some of those myths. So what is chiropractic? Well, first of all, chiropractic means to be done with the hands. So that's why we often use our hands to do spinal manipulation. We have two things that we are responsible for. One of them you probably heard before, and that's called spinal degeneration. So your spine can decay just like your teeth can decay. And so when your spine decays, it can result in what's called osteoarthritis, that A word that we just hate to hear. So osteoarthritis can cause many difficulties in your physical capabilities. So it can cause weakness, it can cause numbness, tingling, it can lead to restricted movement, pain, muscle spasms, and the list just keeps going on and on. So spinal degeneration is so prevalent to where now we're seeing in 10-year-olds, 9% of 10-year-olds are showing up with spinal degeneration on their x-rays. So it's starting to be prevalent in younger ages. And that's due to sedentary lifestyle, things that they eat, their nutrition. It's due to high impact sports. So this is a huge deal. And it's so prevalent that even in 20-year-olds, there are about 30% of them that suffer with spinal degeneration, 85% of 50-year-olds and 96% of 80-year-olds. Now, we kind of expect that with the 90-year-olds or 80-year-olds, but we're seeing it in earlier ages. So just because you're getting older does not mean you have to develop this. And that is what chiropractors are for. We can reduce the prevalence of spinal degeneration or help you avoid it to a vast degree. Now, the second thing that we're responsible for, and the main philosophy of that chiropractic is based upon, is that, first of all, raise your hand if you suffer from stress. Okay, that's all of us. But stress can be categorized into three categories. So there's physical stress. Physical stress has to do with a fall, a car accident. Maybe you sit all day, you stand all day, you lift all day. So those are physical stressors that are put on the body. Chemical stressors entail things in the environment like toxins, things we put in our mouths, chemicals. This reduces a lot of the circulation to the body, including the spine, which has a ton of circulation. So that aids into a lot of problems in spinal health. The third type of stressor is called emotional health. So when you undergo emotional health, you have these emotions all day long. Your nervous system is having to adapt to that. And your nervous system, because it is the master system and it controls everything in your body, it can adapt to all these stressors that we're bombarded with all day long, every day. But when those stressors become greater than the body's ability to adapt, you get what's called subluxations in your spine. So it's like your nervous system goes haywire and starts guarding that area. That leads to some of the vertebrae here in the spine, basically they won't function like they're supposed to. They get stuck, they get fixated, they don't move like they're supposed to. And what that leads to is not only degeneration in the spine, it also leads to muscle spasms, it leads to inflammation, trigger points, and so forth and so on, and also limited movement. So let's talk a little bit about subluxation. So here we see the spine, and we see here is where the skull would be. And in your nervous system, you have the brain, the spinal cord, and then you have all these nerves that exit the spinal cord, and they go to everywhere in your body, including muscles, tendons, ligaments, and guess what? Your organs. So these nerves have a responsibility, and they all have a function. And so when you have subluxations in your spine, it reduces that or interferes with it. So the brain is unable to talk to everything in the body, and then everything in the body cannot relate back to the brain. So you can think of this as sort of like if you're driving somewhere, say you're going to work, the brain would be home. The spinal cord that runs through here would be like a major highway. So you can think of I-20, which we all hate to drive, and 635, right? So these spinal nerves will exit the spine like exits on a highway. So what you really like is traffic to flow, right? But anytime there's a traffic jam, that's when you get an interference in the flow. That flow is a life force, okay? That flow is what supplies neural information to organs and to everything else in your body. So let me ask you something. When you're in a traffic jam, are you excited? No. We get really frustrated. And that's what happens with the nervous system. It gets frustrated. Vertebrae start to lock up. You get muscle spasms, trigger points. You even get nerve irritation, and then it leads to all the symptoms. So that is in a nutshell what chiropractors do. We remove these traffic jams so that your body can function through the nervous system at its optimal level. No need for you to not have a functioning nervous system, right? It should function at its optimal level. And everyone should have a checkup to make sure that you don't have those traffic jams. If you are in the Dallas-Fort Worth area, my office is in Fort Worth. And it's, again, is Rejuvenate Health and Wellness Centers. And you can call us at 817-731-1456.